Wound Suturing Video by Clinical Clerk Justin May A. Rama. Before starting the procedure, it is important to introduce yourself to the patient and obtain informed consent. Explain the procedure to the patient and prepare the materials needed as well as waste disposal containers. For the materials, you need the following: surgical gloves, local anesthesia, syringe, needle holder, pickup forceps, surgical scissors, suturing pad, and sutures. Lidocaine is usually used as the anesthetic agent. Before aspirating, compute for the safe dose you can give to the patient. First step is to aspirate anesthetic from bottle while observing sterility. Next step is to remove air from the syringe. Next step is to inject the anesthesia with level up onto the desired location subcutaneously. It is important to aspirate first before injecting the anesthetic contents to ensure that you have not hit any subcutaneous vessel. You will know that you have hit a vessel if there is a backflow of blood into the syringe. Then check for the effect of the anesthesia using the tip of the needle. The onset of the effect is usually around 2 minutes. Simple interrupted suturing technique. With the dominant hand, use the ring finger and thumb to hold the needle holder in a prone position. The other hand will hold the pickup forceps in a pencil grip manner. For the proper holding of the needle, use the pickup forceps with one hand to hold the needle. Then position the needle at the tip of the needle holder. The needle is then held 2/3 midway. Start suturing by approaching one side with the needle 1 cm from the edge perpendicular to the tissue sutured. Gentle rotation of the wrist following the arc of the needle is subsequently done until the suture exits the other surface. Once it exits, adjust the length of the suture. Form an instrument knot or a square knot. Ensure that the knot is tightly done to ensure wound approximation. In a prone position, handle the surgical scissors properly with the ring finger and the thumb. Cut approximately 1 cm from the knot. The whole procedure is repeated until the entire length of the wound. Lastly, test the integrity and the strength of the suture. After suturing, it is important to do the following steps: perform aftercare and observe proper waste disposal. It is also important to educate the patient on proper wound care to avoid complications.